brain fog, and then anxiety. It will stay all your life. It will stay all your life because you are not interrupting that. You don't want. Why you are not interrupting? Adam, why you are not interrupting? You have anxiety, you have that fogginess, you have everything. Why we are not interrupting? What do you think?
Because it's a loop, right?
Yes.
It's only creating more anxiety, so then you go back and then
Yeah.
it continues to happen.
Yes, perfect. Perfect. We are in that loop, and that loop is there. Sometimes I sleep, my body creates dopamine. After the sleep, I feel a little better because that's the nature created in that thing. Our bodies is like that. We feel like that, oh, yesterday I was so much like nervous, but today I'm okay. Tomorrow I will be much okay. After 8 weeks, after 4 weeks, again it's attacked. Because right now it's in the circle. Circle is moving there. Sometimes any of the problem come, it exaggerates, multiply, not adding up to multiply. Your anxiety is multiplied unless we interrupt it intentionally. How we can interrupt?
Diet changes?
Yes. Diet changing.
Workout maybe.
Yes, that's good. What else?
Minimizing sugar.
Good. Yeah, that's good. And taking therapy. I'm a therapist. You need to address your problems. Trust me, you need to address your problems. If you will not address it, the root cause of that, for example, sometimes we have a tuberculosis. Because of the tuberculosis, I have a fever, I have a cough, I have so many things. What happened? Everything is there. I took Tylenol, I took Advil, my fever gets reduced, my cough gets reduced. But tuberculosis is there, it will come back. For a few days I will be okay by taking Tylenol and Advil, but for the longer run I will be not okay because tuberculosis is there. Anxiety is your tuberculosis. It's a slow poison. And I'm working since like last 18 years a lot on mental health stigma. I visited so many countries, I talk a lot, thousands and thousands and thousands of the talks about just taking care of the anxiety, just taking care of the depression, just taking care of ADHD. Because what I got it, but unfortunately, people did not understand. If they have a pain, physical pain, they will go to the doctor. If they have any type of wound and they can see it, they will go to the doctor. But emotional wounds, they never want to work on that. In anxieties, they never want to work on that. This is the problem, this is the big major issue. Okay, how we are going to discuss about ADHD and anxiety. Fast brain needs regulation. No shame, it's okay. ADHD, fast processing, not failure. When you have ADHD, it's a fast processing, not a failure. Anxiety nervous system is overloaded. ADHD, what will happen with the ADHD?
Fast processing.
Fast processing. But it's not failure. Because mind with ADHD runs at the speed of 65. Normally, the range is 55. 55 zone, but the mind with ADHD is going 65. You can imagine all the cars around you, all the people around you, they are driving at the 55 and you are driving 65 to 70. What will happen? These people cannot reach at your level. They can't. You will be much farther from them and you get like frustrated. I'm trying to tell this thing and that person is not understanding. I tell this thing. And you have so many thoughts one time in your mind. One time. Because your mind has ability to process that. But you don't know. Because of the inflammation, because of those things, you don't know how to process that. It's not a bad thing. ADHD is not a bad thing. It's the best thing. You just know how to regulate. You have a strong line, strong person, you have a strong horse with you. You just need to learn how to control it. That's the important thing. And anxiety, what happened? Your nervous system, Mariam, your nervous system is overloaded when you have anxiety. Oh, sense of failure, sense of not fulfilling those things, sense of those things. All the time your thoughts are on a one direction. So much, so much, so much, so much. to sit and think about that, I need to take a pause. Pause is needed in our life with the ADD, and most of people have anxieties. And ADHD, that's also another problem. Okay, regulation tools calm body first, then the mind. We slow the signals, not the person. What does it mean? When we start regulating our thing, first thing what comes? Body, then comes mind. Because you cannot see my mind. I'm sitting here, but I'm fidgeting. If I have ADHD, I cannot sit. I have to walk. I have to do something. If I will sit for like 10 minutes, it's difficult for me. Because I want something hands-on. I want to, or maybe sometimes I'm very lazy. I don't want to. I want to sit in my bed. I don't want to get ready. I don't want. Some people, they think ADHD is like that, overstimulation. Sometimes you go, because inflammation is there, brain fogginess is there. If like the loop is going like this, if that loop at this time, at the place with overstimulation, it overstimulated. If that loop at that time is coming, fogginess is here, when you are going very down, you can go very down. We call a different type of ADHD, and one person can have a different types of ADHDs. We slow the signals, not a person. What we have to do it, we need to slow ourselves. How? That we will teach you how we can do that. Next thing is Alzheimer's and memories. How we can control those things? If it's in my genetics, Alzheimer is in my genetics, right? What I can do? Can I make better changes in my life? Yes. Can I improve my life? Yes. And we can buy 20 to 30 years, but we need to work hard. I told all my patients when they have like a history of the Alzheimer's, when they have something in their life, whenever they have any type of issues, I told them, I said, don't go with the gadgets. This is a gadget life. And you know, a few days back, actually my husband, he had some issues and he forgot his cell phone at home. And his car started with a cell phone. And after that, it's like the car stopped. And after that, he didn't have a phone. And then he asked someone, can I use your phone? And they said yes. And he didn't remember the phone numbers. He didn't remember the phone numbers. We are so dependent on the things, the gadgets. It's okay, but if in your family has issues of Alzheimer and memory loss, please don't use the gadgets. Please. If at the time of need you can use it, it doesn't mean like I never use it, but try to remember. If you are going to the south, make the map, go with the map and remember it. Phone numbers, remember the phone numbers. And anything, money, calculate the money with your numbers. Don't use the calculator. Try to do it. And if you will start today, you will take 90 days, your brain get much better with that. No gadgets. Gadgets are only when you lost somewhere. You are going somewhere, you know that, all of a sudden you just lost it at that time. To save that time, you should see your GPS. You should know that, the new technology. I'm not saying you should not know it. Don't go with the old age, stone age. Just stay here, but try to remember the things. Try to remember the things. If you will remember the things, it's all the time. It's helpful. Okay? Mariam, she just joined in. Mariam, you need to introduce yourself within 1 minute, and then I will go further with that. Introduce yourself.
Anything specific you want?
Yeah, just yourself, whatever you can tell.
My name is Mariam. I'm 21. I'm a senior in college. I'm studying biology. I'm excited for this program, especially because it's in the new year, so I think it'll be very helpful. And I hope to come out with a lot of my goals being solved and a new plan for the new year. What else?
Wonderful, thank you. Because I don't want the people to think, who are you? At least they should know your name, Mariam. We have two Mariams. One is a college student and the other is a college student too. One is a medical college student. She's going to be a doctor soon, and the other is going to be in medical school too, I think, if I'm not sure. Yes. Okay. Memory fear itself increases stress hormones. When you have the fear of memory loss, it creates the cortisol. Our work lowered the biological risk. We will do in this group We will see whatever the biological risks are, we will work on that. Neuroplasticity. Your brain rewires when sleep, eat, move, calm, and connect. Your brain rewired when you sleep, eat, move, calm, and connect. Can you tell me?
Sleep, eat, move, calm, and connect.
Yes, yes. Because sometimes we are not giving importance to our sleep. Sometimes we are not giving the importance what we eat. Sometimes we are not giving the importance when we move. Sometimes we are not giving the importance to calmness. For example, in this group, I want you guys to be very calm, very calm. And the last thing is connection, connection. Our brain rewire. For example, I'm going to see my best friend. My mind is very happy. All of a sudden, I got a call from my mom or from my spouse, and we start yelling. What will happen? Reconnecting, our brain starts reconnecting in that stress mode, and you will get out from that. Because our brain has a habit of wiring in a same way where there's a lot of stress. Our brain will automatically go in that direction. Automatically we will go there. We cannot handle at that time. And we are so stressful, but we hate to address it. Because we don't have a time. The major thing is that why we are not coming for therapy, why we are not paying attention towards our anxieties, why you are not paying attention towards our stress, because I have to study. And I have to do my business. I have my kid. I have so many things in my life. How I can do work for myself. It seems sometimes selfish. Because I should be selfless. If I will be selfless, then definitely I will help other people. But I'm not thinking about myself. What are the 5 things when our brain rewired?
Sleep, eat, move, calm, and connect.
There will be a test at the end of these sessions. Okay, the brain is always adapting. Always adapting. If you have a habit of getting stressed, if you have a habit of getting stressed, if you have a habit of inflammatory, stop doing that all the time. The good thing God created in ourselves, we can change it. If we will go the history, you will see a lot of people, they get changed. How they get changed? Because they work on themselves. They rewire their brain, they rewire the connection, they create a calmness in themselves, okay? Okay. We will work with the biology.